I'm Leesburg City Commissioner Dan Robuck, and I'm here with Lakefront TV's special coronavirus report. I'm joined first with Dr. David Berger, who is the Chief Operating Officer and Interim Chief Medical Officer with University of Florida's Central Florida Health. Welcome, Dr. Berger. Thanks, you for being here.
Well, thank you very much. It's a pleasure.
I thought we could start a little bit, maybe tell us a little bit about your background and your role at University of Florida Health.
Sure. So I'm a surgical oncologist by training and a general surgeon. I spent 20 years at Baylor College of Medicine in Houston and recently moved to Leesburg to take over as Chief Operating Officer and Interim Chief Medical Officer at both the Leesburg Hospital as well as the Villages Hospital as the Chief Operating Officer as well as the Interim Chief Medical Officer.
Great. And I understand you're also in charge of the hospital's COVID-19 response?
Right. So we've stood up our incident command, really a virtual incident command. We meet every morning at 8:30 to go over what the latest updates are and to look at the status in our two hospitals. And I lead that effort right now.
Okay, so I see a lot of stuff on the news with different terminology that it's hard for me to understand sometimes what they're talking about. I hear coronavirus, I hear SARS-CoV-2, I hear COVID-19. What do these things mean?
So SARS-CoV-2 means severe acute respiratory syndrome, and that is the name of the actual virus. COVID-19 is what they've named the disease. So SARS-CoV-2 is the virus that causes the COVID-19 disease.
Okay,
and
great.
And the type of virus that it is a class of viruses called coronavirus.
Okay, so when people say coronaviruses have been around for a long time, they have, just not this one?
Correct. So coronaviruses have been around for a long, long time, and some of them actually cause the common cold. Others are seen in various animal species, but this SARS-CoV-2 is really a unique coronavirus that has just been identified.
Okay, great. So even though we understand that it's SARS-CoV-2, I'm going to refer to it as coronavirus for the interview just because that's a lot easier for me to say than SARS-CoV-2.
Yeah, whatever's easy.
All right. Okay, so how's it different from the flu?
So it differs in several ways from the flu. So first of all, the flu has been around for a long time. And this flu season, almost 38 million people in this country have been impacted by the flu. And additionally, we've had almost 20,000 deaths from the flu, including in children. So the flu has been here for a while, and we've had a very busy flu season. How it differs from coronavirus is in several ways. So first of all, coronavirus, SARS-CoV-2, is more rapidly disseminated in the population. So the epidemiologists look at this using a term called R0. And the R0 just means if one patient is infected or one person is infected, how many other people are likely to be infected by that one person. So with the common flu, it's about one person will infect another 1.3 people, whereas with SARS-CoV-2 or coronavirus, about 2.4 people, so it's potentially twice as likely to infect people as is the influenza virus. The other thing we know about it is that while about 80% of the cases appear to be mild, people who are at risk appear to have a higher risk of dying from coronavirus than from influenza. And this is especially in patients who have heart disease, diabetes, lung disease, and those people who are above the age of 65. So those populations we know have a much higher risk of mortality or risk of death if they get coronavirus than with the flu. The other issues with the flu is we have a flu vaccine, We currently do not have a coronavirus vaccine. And we have treatment for the flu. So if you get the flu and you're identified early on and you see your doctor right away, you can get a medication that will lessen the symptoms of flu. Coronavirus, we currently have no treatment except for really supportive treatment. So there are really very important differences between flu and coronavirus.
Wow, so if 20% are severe symptoms, would that mean that they would need medical attention at that point?
Right, so up to 20% have been identified as having respiratory difficulty, so that they would need to be taken care of and evaluated in a medical facility.
And I've heard that this disease, you stay in the hospital a little bit longer than you do with the flu. How does that compare?
Well, most people, if they get admitted for the flu, and those people that have the flu that get admitted usually have also significant respiratory illness and complications of significant respiratory illness requiring oxygen. So those patients, usually 3 to 5 days if they're going to recover, whereas patients with coronavirus who have significant respiratory illness and need to be admitted, looks like they have a longer course. And a lot of those patients ended up with secondary bacterial infections as well. So the course can be longer in those patients.
Okay, and then what about the fatality rate? How does that compare with the flu?
So it looks like across the board that the fatality rate for coronavirus is approximately 10 times that of the flu. So the flu, the common flu, it looks like what's been reported in terms of the mortality rate is really below 0.1%. For coronavirus, in patients below the age of 50, the mortality rate is about 0.2%. So it's at least 10 times higher. But the people we're really worried about is the people I mentioned who are at high risk: heart disease, lung disease, diabetes, immunosuppression from any cause. Their immune systems are not working up to par because of they're on medication or potentially undergoing treatment for cancer. And then the elderly, anyone above 65, it looks like they're at an increased risk of mortality, and the risk can be up to 16% in patients above the age of 80 who have any of those other conditions.
Wow, that's pretty stunning.
Yeah, so it's significant mortality rate for at-risk groups. But the general population, while it's higher than the flu, it is much, much less.
Okay. And now I've heard that it doesn't really affect children. If it's not affecting them, is it because they're not getting it, or is it because they're just not showing symptoms?
So it appears that children can be carriers, and most children get, if they're going to get a case, get a very mild case of coronavirus, and no mortalities have been reported in children. So that's really good news. But since they do get relatively mild disease, if they get really any significant symptoms, they can be carriers and spread the disease to other people who potentially are at significantly higher risk of complications from the disease.
Okay, gotcha. So how does the disease spread?
So the disease spreads, it's called through droplets, and droplets are produced when people either cough or sneeze. So if you are in close proximity or you're near someone who has the disease and coughs, and they cough on you, then the virus then gets to your respiratory passages, your nose or in your mouth, then potentially you can get the disease. The other thing is from surfaces. So unlike a lot of other illnesses, coronavirus can live on surfaces for up to 3 days.
Oh, wow.
So one of the things we recommend if you're in public areas is to make sure you wipe down any surfaces with the appropriate bleach or alcohol containing solutions.
Okay. Now, one thing that I've heard a lot of people talking about is that, well, as summer comes around, that's going to kill this, kind of like we don't have much flu in the summer. Well, is there any truth to this?
So the issue is that coronavirus was first recognized in November. So we have never been really through a summer season. So we have no idea what's going to happen as the weather changes in the Northern Hemisphere. And you have to understand that there are cases in the Southern Hemisphere, which is in summer right now. So Australia has summer season, and they've had cases documented as well. So we don't know, and we shouldn't count on the warmer weather eradicating the virus. We have to make sure we continue to be vigilant and try to get ahead of it.
That makes a lot of sense. Are there any other kind of common misconceptions that are floating around out there that you've heard that you think we need to address?
So a couple of things is people think they can get it from mosquitoes. You can't get it from a mosquito bite. People think that Asians are at higher risk of getting the virus, and we have no proof right now that any specific group is at higher risk. Some of the other misconceptions is that antibiotics are effective. Antibiotics are not effective, and we do not have any drugs that can treat coronavirus at this time. And the other misconception is that we already have a vaccine, and clearly we do not have a vaccine. Various companies have claimed they've identified a potential vaccine, but none of the vaccines have gone through either animal testing or human testing to show that they actually work.
Okay, got it. So it'd be a little while before a vaccine could even be tried to see if it would work.
So most of the companies who are trying to develop a vaccine say they're at least 3 to 6 months away from even trialing a vaccine.
Okay. So what are the common symptoms for this virus?
So the common symptoms are like any other respiratory illness, but the most common things are usually a dry cough, not a cough that produces a lot of mucus or sputum, and then a fever. And as the disease progresses, really shortness of breath is the other thing to really look for, because that really signifies a more severe case of coronavirus.
Okay. And I know we don't have a lot of cases that are confirmed in Florida yet, but I've also heard we haven't done much testing. Do you know how much testing we're doing?
So we have 42, as of this morning, we have 42 confirmed cases in the state of Florida, 2 deaths from coronavirus within Florida. We have about 1,300 confirmed cases nationally, and there are a number of other patients right now that are being tested, but clearly we haven't tested the number of potential people that we would like to have tested to this point. So we don't know how widespread it is, but certainly it has not been seen as of yet in Lake County.
Okay. And I've also heard that a lot of times people aren't showing symptoms for a while, even though they have the disease. Is that true?
So usually it takes about 5 to 8 days to develop symptoms, and usually the course of the symptoms is another 5 to 8 days. So that's why when people are returning from travel to areas that have a lot of cases or go on a cruise, they're being asked to self-quarantine or remain at home for 2 weeks.
Okay, all right. And so, and then also you mentioned 80% are mild, and if it takes 5 to 8 days to show symptoms, we could have a lot of people that theoretically could have this, and we just don't know yet.
And that's the potential risk, is that we don't know at this time really how widespread it is in this area of the country. We know that there are hot spots right now in the United States. Washington, Boston, New York, and California all are beginning to experience significant increases in the number of positive cases they're seeing.
Okay. So say someone, they have these symptoms. Maybe it's not to the point where they can't breathe, so they don't need to call 911, but they're struggling a little bit. They've got the fever, the dry cough. What should they do? How should they handle this?
So the best thing for them to do is contact, if they have a primary care physician, contact their primary care physicians first, and ideally by phone.
Okay.
You don't want everyone running to the physician. First of all, it will overwhelm the physician office, and as I mentioned, it's extremely contagious, so you don't want to spread it out in public. And if you're having mild symptoms, the best thing to do is call your physician, tell them what's going on, and they can, based on your symptoms as well as your history, and the important things are in the history are recent travel to one of the high-risk areas, China, South Korea, Japan, and now Europe, or being on a cruise ship. All those have been identified by the CDC, or the Centers for Disease Control, as places that are experiencing a lot of cases. So if you have that history with a cough and a fever, you should explain that to your primary care doctor, and they will tell you how to get tested for the virus. If you can't find your primary care physician, or you don't have one, the next best thing to do is contact the Department of Health, and they'll run through all of those issues. If you can't get the Department of Health, then we have urgent care centers throughout Lake County, and including, we have one at our hospital. And if you're sick, really sick, and having problems breathing, immediately go to an emergency room. And when you get there, make sure you tell them that you're having cough, fever, and you've traveled.
Okay, got it. So you have health here in Leesburg and the Villages. What are the hospitals doing to prepare?
So we've been actually preparing since January. Last week, we really kicked it into high gear, and we've built our virtual incident command center, which we use for any time we have any kind of emergency. So we're approaching this as an emergency, since the World Health Organization has identified this as a pandemic, meaning it's spread throughout the world. So we're treating it as a very important event. The Centers for Disease Control have put out a checklist for hospitals to follow to prepare and to treat and to prevent it from spreading. And we've implemented all of that. So we've prepared for potential surge. Right now at our two hospitals, we're screening all visitors who come in. We have a screen set up that asks them the questions: are you having a cough? Do you have a temperature? And have you traveled, or have you been exposed to a COVID patient? And if those questions are yes, we're excluding them from the facility. We've also narrowed down the entry points to our hospital so we can screen all our visitors. Anyone who comes into our emergency departments or our urgent care who has symptoms, we're segregating from the rest of the patients in the emergency department, because we don't want them to potentially infect people who are there for other reasons, like sprained ankles or broken arms, need sutures. So we're being very careful to segregate them. Our infection control specialists communicate on each patient we suspect of potentially being a coronavirus patient with the local health departments, and the local health departments are dictating who gets tested and who doesn't get tested, and then we're making sure all the patients are properly isolated, and that the practitioners, the clinicians in the hospital who are taking care of them, get appropriate equipment to protect them. So a lot of work going on in the hospital. We meet every morning at 8:30 to update on patients that we've seen, any issues that we identify with staff. So it's really an all-out effort to deal with this right now.
Now, you mentioned the Department of Health. Can a clinician at this point, are we to the point yet where if they feel the test needs to be done, can they order one on their own, or does it still have to go through the Department of Health?
So there are ways to order it on your own. There are commercial labs that will do the testing. The problem is if you're in your own office, you need to do the swabbing of the nasal passages and then send it special courier to the lab. The best thing to do if you're a practitioner in a private office is to contact the health department. And they will help guide you in terms of how to get it properly tested.
Got it. So what should people be doing on an individual level to either prepare or to minimize their exposure?
So there are several things that people can do to prevent or to the best of their ability from getting it. The number one most important thing is to continually wash your hands. This is key. Whenever you touch a surface, if you're dealing with other people, wash your hands. The other thing is to avoid touching your face and your nose as much as possible. What they are recommending also is social distancing, meaning when you're in public areas, try to remain 6 feet away from the nearest person. Don't go to large events that are, especially those that are inside. And you've seen that all the major sports leagues now have canceled or postponed their season. So March Madness has been canceled, the NBA is on hold, Major League Baseball, and even the PGA has suspended their activities because you don't want a lot of people congregating in a relatively small area. At home, it's key to prepare in case there's a wide outbreak. So what do you need to do at home? So everyone should have at least a 60 to 90-day supply of their medications. You should have food staples in case you're required to stay at home, and things like peanut butter, canned goods. The other thing you should have is key phone numbers available, the Department of Health, your primary care doctor, in case that you do get sick and do need to be able to contact someone that can help you out. So those are the principal things we can do right now. So hand washing, social distancing as much as possible, avoiding large events that are especially indoor with a lot of other people, and making sure you have a plan in case you have to stay inside for a period of time.
Okay. And now, you mentioned earlier about how much more deadly this disease is for elderly people, especially elderly people with other complications. So would it be safe to say that if you're in that group, you should maybe almost even go take it more seriously with the social distancing and really trying to minimize your exposure? So
I have an 83-year-old mom, and basically I've told her to stay home as much as she possibly can. And if she's going to go out, to remain at a safe distance. And my mom likes to play Mahjong, so that's a small group. So she can certainly go and play Mahjong as long as her friends are okay. But I've been very clear to her, stay home as much as you possibly can.
Okay, that's good advice. I'm going to make sure my mom sees this clip. She's not quite in her 80s yet, but she still needs to listen. So, so then I guess as a community, are there things we should be thinking about from kind of a broader community level that we should be doing?
So as a community, I think one of the things that needs to be considered is communal events. And at what point do we start thinking about canceling those communal events? What are the risks at the communal events? The other thing people are recommending, and the CDC is recommending this, as is the Department of Health, is to keep track of who is at these events to the best that we possibly can. Also, make sure we have adequate facilities to allow for hand washing, and if we don't have sinks, certainly making alcohol-based gels available widespread. So, and then certainly preparing in terms of making sure all our hospitals and facilities are able to handle an increased load, and then working with the health department to identify other things that potentially will need to be canceled over time or postponed.
Okay, that's some good advice. I know you mentioned the sports leagues canceled, and seeing that, and then seeing Disney close down, I mean, that really hit home for me. These are companies walking away from billions of dollars of revenue, so to see them take it this seriously, I think that really opened my eyes. Is there anywhere that people should go if they want to get more information about this? So
this cdc.gov is an excellent website, and if you Google the Florida Department of Health, that also has a ton of information. Try to go to reliable sites, and those are the two best ones that I've identified, because there's a lot of misinformation out there, and we want to make sure that people are getting the right information. And there's a lot of good information for the public on those sites, including various infographics, pictures of how to hand wash, what you should do, checklists in terms of preparing your home. So those are by far the best places to go for more information.
Okay, great. So is there anything else you want to discuss?
No, I think the point is that this disease, this viral disease, coronavirus, has reached our shores, and it will continue to spread over the next few weeks. But I think a lot of people are taking a very proactive approach to try to control it. It's really important to take care of yourself and prepare in case you or a member of your household becomes ill, and know what to do, and try not to panic. We are faced with multiple viral diseases over the course of humanity. This is another one. Yes, there's increased mortality over the flu, but most cases are relatively mild. But we need to be very vigilant, aware it's out there, protect ourselves, and make sure that we're following the guidelines from organizations like the Department of Health and the CDC.
Well, thank you, Dr. Berger. I really appreciate that. I know I learned a lot, so I'm sure our viewers did as well. So thank you so much for being here.
My pleasure.
So we're going to take a quick break, give you time to go wash your hands, but then we're going to be back for the second part of our special report on the coronavirus, when we're going to bring in some local experts to talk about Lake County's response to this virus outbreak. Thank you. Welcome back. I am Commissioner Dan Robuck, and this is a continuation of Lakefront TV's special report on the coronavirus. I'm joined here with Dr. Christy Burns, who is chair of the Lake County School Board. Thank you for being here, Christy.
Thanks for having me.
Now, I know you're the chair of the school board, but you have a little bit of a different background than probably most people on a school board, as they heard when I introduced you as Dr. Burns. So can you give us a little information about your background?
Yes, so I'm a biochemist. I got my doctorate in biochemistry from Georgia Tech, and then I went and worked at DuPont on chemical warfare agent decon. And so I had actually some interaction with some of the biowarfare conferences. So I have had a little bit of exposure to the concepts of pandemics and whatnot.
Wow, well, we're certainly lucky to have someone like that on the school board, unfortunately in a time like this. I mean, not a good thing. But,
yes.
We're here.
Nobody wants this import.
Yeah. So what's the current guidance for the Lake County schools? What's currently being told?
Currently, we are focusing on good hygiene, hand washing, making sure we have supplies for all of our students. We have, we're getting hand sanitizer in the classrooms. We do have enough wipes in the classrooms. All the surfaces are being wiped down, hot spots are being wiped, like your doorknobs and the devices that get passed around and things like that are getting wiped down. And then as for other, to observe the children, when a teacher sees that a child is feeling ill, we have nurses in all of our schools, so they can go to the nurse, and there they'll either be quarantined if they have a fever and sent home, and I mean quarantined for the day. I don't mean like some thing. I just mean the nurse will call mom and dad. They'll either go home, but if mom and dad can't get them, they'll stay in the nurse's office to stay away from the children.
Okay. Now, I know, we talked about that's current today, but things are moving so fast. It seems every hour, guidance is changing from the state, from the CDC. What's the best place for parents to stay up to date on what's the latest is with the schools?
Lake County Schools website has a pop-up page that is the first thing you'll see when you go to the Lake County Schools website, and it has all the latest CDC guidance on it, and that's what we're following, and that's what we're asking parents to do.
Okay, great. Is there anything else you want to say, or any other precautions people need to know about?
Well, obviously wash your hands, and just keep washing your hands, but also this is an evolving situation, and Broward County Schools just in the last couple hours closed down, so that's a possibility. We are looking at all of our possibilities, so be aware and go to the Lake County Schools website for updates.
Okay, great. Well, thank you so much for being here.
welcome.
Really great to have someone with your expertise on the school board as the chair. So we really appreciate that.
Thank you.
And now please stay with us, because coming up next, we're going to have Fire Battalion Chief Jamie Ricketson from the Leesburg Fire Department to talk about what we're doing here in the city of Leesburg. Welcome back. I'm now joined by Fire Battalion Chief Jamie Ricketson from the Leesburg Fire Department to talk a little bit about what we're doing here in Leesburg to keep everyone safe from the coronavirus outbreak. Battalion Chief Ricketson, so I was hoping you could talk a little bit about things from a first responder's perspective. As people get sick, if that happens and they're out there, you're going to come into contact with them. So what is the fire department doing to help mitigate that risk?
Well, we treat all calls with due diligence. We have in place personal protective equipment that we wear, whether that be gloves, eye protection, gowns, just depending on the call. And so with this particular new onset of the coronavirus, we treat it exactly the same as we would any other illness. And based on the information given from the initial 911 call, all the way through dispatch down to the guys responding on scene, we use that information and treat it accordingly.
Great. So it sounds like, having to deal with cleanliness and disease, this isn't something that's new. The virus may be, but these procedures are not. So I think you'd be in a good position to maybe give people some kind of tips about just good general hygiene.
Yeah, absolutely. If nothing else comes out of this virus, the awareness of germs for the general public is just heightened. And so, we would like you to wash your hands, take approximately 20 seconds to do so, or sing the happy birthday song, whatever you got to do, just so that you spend some time cleaning your hands.
That's some really good advice. Now also, because you're as first responders, even in a car wreck, you may be the first one on the scene to someone, and assuming they're not seriously injured. But say maybe they have a cold and have been feeling a little sick. Would it be helpful if they let you know that they weren't feeling well?
Oh, absolutely. If you're feeling symptoms that you're already sick, or you're coming down with something, it's obviously going to help out the whole system if you tell us right off the bat, and that way we can advise the ambulance personnel and then the ERs as well, or anybody you come in contact with at that point. It gives them a heads up.
Well, thank you for being here. I know I've learned a lot and really appreciate that. Thank you for watching this special report on the coronavirus outbreak. I hope you've learned a lot. I know I have. There's some really great information on steps that you can take to help keep both yourself and our community healthy and safe during this outbreak. For more information, I would encourage you to make sure you're going to reputable sites. So cdc.gov is a great place to start. All the most current information is up there as well. I also really like ourworldindata.org. It's a great site. They have Johns Hopkins data, they have the WHO data, and some other data sources. But please make sure to stay informed. This is changing rapidly. And until next time, I'm Leesburg City Commissioner Dan Robuck. Thank you.